Hey, it's the Dr. White, and I'm back at the Dr. Whiteboard, and we're talking about treating dry eye. I told you a little bit about the different types of artificial tears that we use, and everybody who has dry eye will get some kind of artificial tear recommendation. But sometimes artificial tears aren't enough, and we have to use a prescription medicine. Just like with the artificial tears, where we kind of break it off into two categories, there are actually two general categories for how we use a prescription medicine to take care of dry eye. The most common type of dry eye, as we've discussed, is not enough tears. So if you have a low tear quantity, we have to do something to try to get you to make more tears. Not only that, but the interesting thing is that when you have a low tear quantity, you often have poor tear quality as well. But if that's the biggest deal problem, we find that sometimes it's caused by inflammation. And the inflammation, chronic and low grade, is what causes the dryness. And when that's the case, there's an absolutely brilliant medicine called Restasis. You may have seen some commercials for it on television. The commercials are actually pretty good. Restasis works by reducing that chronic inflammation. And once you reduce the chronic inflammation, it's like you've unwound this vicious cycle, and then you wind up a virtuous cycle. So the first thing we have to do is we have to make the inflammation go down. And once it goes down and goes away, your tear production starts to go up. Not only do you make more tears, but it turns out, and this is really very cool, that if you had poor tear quality because of that inflammation, the tear quality improves as well. So, Restasis is a very common prescription that you'll hear about from your eye doctor, or if you come to Sky Vision, you'll hear about from us. And what it does is it reduces the chronic inflammation that causes the most common type of dry eye. Pretty easy to use. It's an eye drop. You take it twice a day. You take it twice a day pretty much for as long as you want to feel well. The one thing about Restasis that's a little bit interesting is that it doesn't work right away. It's not like a typical American medicine. It's not like a Tylenol. If you have a headache and you take a Tylenol, your headache goes away within 20 or 30 minutes. It can take a few weeks for the Restasis to work, but if you're patient and if you stick with it, Restasis works in our hands about 95% of the time. Great stuff. So, if we're treating dry eye and you have a low tear amount and artificial tears aren't good enough, they're not making you feel well enough, a lot of times that's because of chronic inflammation, and you may hear Restasis as the solution. So I'm the Dr. White. We're here at the Dr. Whiteboard talking about treating dry eye. We'll see you again.